Wonderful.
She knows a thing or two about filming.
Okay. So, especially in prone when working on the erector mass, there's these tiny little things that become really important. So, you've all experienced this when I'm walking around and showing you. Do you believe I'm working the erector mass now? No, why not? Like, so too much movement of everything else, right? So when I'm trying to work on a soft tissue, again, working perpendicular to fiber direction is exceptionally important. And remembering that the basic rationale, whether it's correct or not, is that there's no protective mechanism across fiber direction. There's protective mechanisms in fiber directions. Keep that concept in mind. Whether it's the correct one to explain it or not, it does a decent enough job now. Now, if I do that, do you believe that I'm on the erector mass even though it looks like nothing's happening? Right? Now, he's breathing, so there's constant movement. As long as I give nothing up, it's not particularly firm. As long as I give nothing up, and as long as I talk to fill the time, essentially what'll happen is when I let go, you would all agree generally that I'm not putting over pressure. I'm not pushing on this. I'm just holding it. So as he's breathing, this may not be the perfect place to do this because there's not a ton of tension for him, particularly here, based on how my hand is. If I was to tell you where there's more tension on my hand, there's a little bit here, but there's more up here. Would you generally agree that there's more up here, but there's also some here-ish? Yeah. The reason that I can tell that is because my hand is spanning it, and I can feel and discriminate the parts of my hand from one another. Did that feel interesting to you right there? Yeah. So he just took a deeper breath. You didn't necessarily notice that, but the rhythm of his breath changed. It didn't do anything. Sometimes these weird things happen. You don't necessarily, quote unquote, feel the release, but you'll feel stuff, right? So the big deal is when I let off, what you'll see. So when I let off, right? See how far that went? Right? It's subtle. You can't come off fast if you're trying to show somebody this, but if you come off nice and smooth, you'll see it. Now, if I go up here, really it's this side of your back right now, right? Okay. Visually, just superficially, you'll see a twist. Sometimes it's the table, sometimes, so turn your head the other way. Right? See how that didn't change? It's still kind of this. There's just the lump and the hump, right? So probably this side is what's going to need a little bit more attention. Are you comfortable with your neck that way?
I prefer it this way.
Then leave it that way. Yeah. No, the neck has to face a particular way because of lymphatics. No, it doesn't. It has to face the way that they're the most comfortable with. This is why my habit is to treat the neck before I put somebody in prone, as a general rule, whether I have a face hole or not. In this case, I don't have a face hole, so this wasn't just for demonstration purposes. I would have treated his neck just to be nice, right? Because if there's a preference in movement, then we respond to that. But anyways, here, so again, you don't believe me, right? You see all the auxiliary movement. Now, if I connect there, right, so you see how there's a little bit of down, and then that's it. These muscles aren't going to move particularly far. Now, if I want to modulate this, if I use the leg, it'll do something, right? So you see how much that pelvis moves there. Now, you don't feel much coming into my hand with this, do you? No, okay. And for the sake of the fact that he doesn't have a mic, he said no. That works better, right? Yeah. Right? Now, if I wanted to soften it up, right? So now this is a still muscle moving bone here. The pelvis is a much better lever or handle if I'm working on the erector mass, especially in prone. I can just get way more out of it. So if I wanted to go softer in my hand so that it takes away some of the tension. So I'm going direct on the erector mass, but I'm using concepts of indirect. I'm making it all softer. Whereas if I wanted to put some challenge on it, I can just pull it towards me. Right? Some tension builds into it. It's not uncomfortable. It works, right? There you go. So you see that I'm just showing you what this looks like. So now this is mildly oscillatory, right? There's kind of an on-off. And again, if you're watching my up-table hand, you're not going to see a ton of movement, right? He's just adjusting himself. So now, I didn't wait as long. Right? It's not this. That's overpowering. There will be other sensory fibers that will do stuff, right? That nice, just connection there, right? So just to show you, right? This is initial. If I let off right away, there's some movement. If I just hold, and we'll speed it up, right? Also, some of you will have come up with the concept of going active on this. So patient active, where we don't have them contract the thing we're working on. Push this hip on the table, right? And let it go. Good. Push this hip and let it go. They both do something positive. Push this shoulder straight down and let it go. That does something cool. Push this one down. That does nothing. Let it go, right? So this hip, good, let it go. This hip, that's the one that does the most. Let it go. Good. Push it again. Let it go. Push it again. Let it go. I hold on, and when he lets go, yeah. You see, now the difference, right? So we're working perpendicular to fiber direction to avoid protective mechanisms. We're not pushing hard to avoid general sensation. We've got a nice broad hand, so it's not at any one point. He's not going to freak out, whereas if I did this, that's not as enjoyable. Is that correct? He says yes, right? But the pressure is about the same, right? So that's just nicer. Broader contact allows for less pinpoint sensory information to him. Right, so a broader hand does better. It's easier on my hand. I don't have to really tighten my arm up. It's just nice and gentle. As he's breathing, we get the on-off. It's just going to happen. If I want to modulate, the pelvis is generally a better handle, or the pelvic region. And then I can go patient active. It's all there. It all blends together. But this is the one that you're probably going to use the most when working on the erector mass, especially for any form of vertebral motion restriction, right? Seated works really good. It's just harder to get at the soft tissue. So if you're looking for the soft tissue, this is probably the best, right? But in seated, it's fine. It works. It's just they have to hold themselves up no matter what you do. So they're a little bit more likely to fight. In lateral, it's just that in lateral. But look, see that? Okay. Lay on your side facing that way. Pass that pillow, please. You can stay right there with the camera. The biggest deal that we're looking to avoid if we happen to be working in lateral, so again, it's like this, just for the sake of the camera not being able to see this. Do you believe me that I'm working on the erector mass? Do you believe that I'd be working on the erector mass now? Now, because you can't see it, all I do, I pretend it's like pinball. I just do that, right? But here. Now, are my thumbs the best for it? My thumbs are not the best for it, right? If you look at my thumbs, they're not the same as one another, but you do the best that you can. You just kind of lift up on the erector mass. If I wanted to, I can counter rotate. But again, the pelvis is still better because I can sit down. It's way easier. Okay? Sweet. Thanks.